Hey YouTubers, welcome to my channel Andrea René Abroad, where I talk about Peace Corps, travel, and working abroad. I'm a returned Peace Corps volunteer who served in Nicaragua from August of 2016 to April of 2018. I'm currently traveling around Europe, but before I left, I did make a few backup videos in case I wasn't able to upload new videos for you at some of the places where I'll be staying along the way. A few months ago, when I was still in Australia, one of you commented on one of my Peace Corps videos asking if I could make a video about my experience with healthcare during the Peace Corps. So I thought I'd make a video for you all on that covers everything from your pre-departure examinations all the way through your COS exams. Let's go ahead and first talk about your pre-departure examinations. When you first are accepted to Peace Corps, it is a tentative acceptance, right? You have to be able to pass the Peace Corps medical exams in order to actually depart for Peace Corps itself. Again, you will be accepted to the program on the basis of your application and all the other different things that they're going to be looking at. You will have to do a legal exam as well, a background check, but that's not what I'm going to talk about in this video. Something to keep in mind here is Peace Corps will only be able to reimburse you $60 maximum for the different medical examinations that you do before you leave for Peace Corps. So if you don't have health care, that's going to be an issue because there's a ton of different immunizations you need to do, dental examinations, physical examinations, and again, Peace Corps will only refund you up to $60. If you don't have healthcare, do consider looking into healthcare of some sort before you do your medical pre-departure exams. Now, once you are accepted to Peace Corps, within 1 or 2 days, you will be sent an access code to the Peace Corps Medical Portal. It will have its own login, which is going to be different from your login for the application website and also from the pre-departure learning grounds, learning center, where you do the different tests on safety and security and HIV/AIDS awareness and those different things. So there's a few different portals that you have to keep track of, but you will be given one specific to medical needs, and it is a very safe website. This is run by the US State Department, so they're very, very careful with your personal information and your medical information. When you first get access to the medical portal, there will be a long list of different things that you need to do. Personally, the way that I approached it was I went through each of them and I actually printed each of them off. It was just easier for me to have it all laid out in front of me. And what I did was I looked at everything, and then luckily I was still under the age of 26 when I was serving in the Peace Corps, so I still had access to my parents' healthcare plan. Luckily, our healthcare provider has an online platform where I was able to access my medical history as well as my immunization history, and I was able to start just checking off some of the boxes. Now, the way that the Peace Corps Medical Portal works is that you will need to show proof, show evidence of having received the different examinations and immunizations that Peace Corps requires. So I looked through my medical history and I was able to identify that I had already gotten some of the immunizations that Peace Corps required. So again, I just printed off those documents and I stapled them together with the different tasks. So I had the task on top and then the immunization record or proof of exam or proof of the illness just right underneath. Then what I did was I scanned it and then I uploaded it to the website, and then I stuck a little sticky note on top that said submitted, because there was just so much paperwork to keep track of. That was just the best way for me to approach it. After I had already identified all the immunizations that Peace Corps required that I already had in my medical history, I went ahead and made appointments with my doctor and my dentist, because you will need to do both a physical exam as well as a dental exam. Let's first talk about the requirements of the dental exam, because that's a lot faster and easier, at least in my experience. So again, health insurance, dental insurance will be important here. Now, I will go back and say, I'm pretty sure that those fees are separate. You can be refunded $60 for medical examinations and $60 for dental examinations. I do seem to remember that those were two different fees. Now, I'm not going to try and memorize all the dental stuff that I had to do, so I actually have it jotted down here, and I'll go ahead and read it to you all. So basically, they do need to have some x-rays of your teeth. This is basically in case anything happens to you during Peace Corps, that you're able to prove that it happened to you during Peace Corps. Basically, they're going to need, full x-rays of your teeth. That can be either the full mouth or Panorex with 4 bite wing x-rays. And then they'll also need to do probing for gingival recession. So that's like when they measure how much recession you have on each of your teeth with the gums. And then they will also just do a general evaluation. If you, for example, have any orthodontic work currently when you're serving in the Peace Corps, your dentist is going to need to jot that down. If you have any crowns, implants, any sort of thing like that in your mouth, in your oral history, they're going to need to write that down for you. So that's basically the dental, pretty straightforward. They just basically want to know what your mouth looks like before you leave for Peace Corps. Now, the medical side of things was a little bit more tedious to get through just because there were so many different immunizations that I had to do. I mean, I could go through the list here a little bit, but it was just like so many different things. They wanted you to do the TB skin test, HIV blood work, CBD differential, hepatitis B surface antibody, hepatitis B surface antigen, hepatitis C antibody, basic metabolic panel, G6PD blood test, TD, tetanus, diphtheria immunization, also the MMR, which is just the measles and mumps and rubella. If you went to public schools in America, you probably have all of those already. Those were just some of the different immunizations that I had to take care of prior to departure. And like I said, some of these I already had, so I just checked my medical history and was able to prove that I already had these immunizations taken care of. So for those of you who are women serving like myself, you will need to have a current Pap smear test. Now, my recommendation with this is even if you are not quite yet due for your next Pap smear, I highly recommend that you just go ahead and do one right before your Peace Corps service, because if not, Peace Corps will be required to provide you with a Pap smear exam during your service, and depending on which country you're in, this could be a good Pap smear or a bad Pap smear experience. I forget what age you have to be to get mammograms, but if you are at the age where you are required to have mammograms every couple of years, you will need to get one of these before you depart. And it's the same sort of thing, you know, talk with your doctor. Do you feel like doing one in country when you're like in service and having someone from your country of service performing your mammogram, or would you rather do one before you depart? So I'll let you guys decide, but you know, I feel like it's kind of the same thing with the Pap smear. And then for you men, honestly, you'll have to talk to other returned Peace Corps volunteers who are male, because I have no idea what sort of things the men had to do prior to departure. So beyond just your general physical exam, which your doctor will do for you, they'll fill out the paperwork and sign it and basically state whether or not they think you are medically fit for service, is you will need to fill out a functional ability questionnaire. Now, when you fill out the functional ability questionnaire, you don't need to be worried about, you know, oh, should I lie or whatever. No, just tell the truth, because Peace Corps will be very accommodating for the most part. There have definitely been volunteers who have served who are differently able, whether that is a physical, a visual, or maybe your hearing is a little bit different from other people. You know, they will definitely be accommodating to you. I don't use glasses myself. I don't use contacts, but I do remember hearing that they want you to bring 2 pairs of glasses, just because it will be very difficult for Peace Corps to replace your glasses if they were to be lost, broken, or stolen. Definitely be sure that you have 2 pairs of glasses that are up to date with your prescription, or at least comfortable enough for you to bring to Peace Corps with you. The last thing that I did want to read to you all prior to moving on to healthcare during service is just the medical care compliance. So this is really important, because remember that you are serving under, you know, this is funded by Congress, this is funded by the US State Department. They need to be taking care of you. And so there is a medical care and compliance thing that you need to fill out. So basically it's just, it says, I understand that I will receive country-specific immunizations and vaccinations according to the CDC recommendations during pre-service training. If I choose to be immunized before arrival in country and beyond the requirements for medical clearance, I understand that I will be responsible for the cost incurred. 2, I understand that I will be required to take all immunizations and vaccinations required and provided directly by the Peace Corps and for Peace Corps service in my host country. 3, I understand that I cannot refuse to take malaria or other medical prophylaxis if required by the Peace Corps for service in my host country. And finally, 4 is I understand that consistent failure to follow the medical advice of Peace Corps medical officers may result in termination of my Peace Corps service. So they don't mess around. This is like serious, but you know, as long as you follow the rules, you should be okay. Now, if you are one of those folks who is anti-vaccination, anti-vaccines, the Peace Corps basically just might not be the the greatest way for you to volunteer abroad. So that's pretty much what the pre-departure medical exams will look like. Again, you'll just need to upload all of the information to the Peace Corps Medical Portal, and then they'll get back to you fairly quickly about whether or not you are medically cleared for service. All right, so let's talk about during Peace Corps training. So as you heard in the medical compliance rules, they did mention immunizations during pre-service training. For those of you who haven't seen my video on pre-service training, I recommend that you definitely check that out, as I won't be going into the details of pre-service training in this video. But as far as medical goes, basically each time you have a training in a group, well, not each time, but there's a few times throughout where the Peace Corps medical officers, the PCMOs, will show up to your training, and they'll be armed with, all the syringes to vaccinate you guys on a slew of different things that they need to do. Now, if you are like really concerned about getting, duplicate vaccinations, I definitely received some duplicates that I knew for a fact that I had already received, but I received again. The only way that you can get out of that is if you have a World Health Organization immunization card. That's the only way that you can get out of it. I didn't know that, so I didn't look into getting a WHO card, but if you're really concerned about getting duplicate vaccinations, I recommend that you get a WHO card. The PCMOs are really great. None of the vaccinations left any scarrings or anything like that, and they always gave us candy after the vaccine. So it was really nice, and they were really great. The doctors are approved by the US government. I don't know of anybody who ever, got sick or anything like that after vaccinations. During your service, you will of course have a Peace Corps phone and phone number. This is paid for by Peace Corps. So if you ever have any sort of medical issue during your Peace Corps service, you will have the phone number of your PCMO. There will be multiple PCMOs most likely in your country. So you just go ahead and call them, and there actually will be a PCMO hotline. So that is a 24-hour phone number that you can use if you are in any sort of medical emergency. Now, each country will give you specific requirements as to what to do if you, need to go to the hospital immediately, closest hospital to your site. So at least in Peace Corps Nicaragua, they made us identify a community member who owned a car who would be able to transport us either to a local hospital or even to the country's capital where the Peace Corps office was. You will likely be asked to do something similar, but I won't go into too much detail just because I have a feeling that it's probably different in each country. Now, I haven't talked about just general prescription pills that you might be taking or different, basic over-the-counter things that you need from a pharmacy. Peace Corps will take care of this for you completely. Now, I actually have written a blog on this topic which talks in depth about the different over-the-counter medical things that Peace Corps supplies you with. So everything from mosquito repellent and sunscreen to ibuprofen to condoms to even Plan B, depending on your country and the rules surrounding birth control. If you have any prescriptions, basically all you'll need to do is email your PCMO on a monthly or maybe every 3 months basis, just letting them know that you need to refill your prescription. So if you're on any prescription medication, no need to worry about it. You will be taken care of during Peace Corps. Peace Corps will pay for that. You will not need to pay for that out of your own pocket. You will have a mid-service medical, so that's halfway through your service, a year into your service. You will go into the Peace Corps office and have just a general, your annual exam. It will be given by one of the PCMOs, and it was basically the same thing as it is here in the United States, just your vitals, basically. And then for the mid-service medical, you will also have an appointment with the hygienist. My experience with this was I didn't think the hygienist did a very good cleaning. I didn't tell Peace Corps this, and you guys don't have to either, but when I went home for Christmas, halfway through my service, since I was still under the age of 26 and on my parents' health insurance, I just went and visited my own dentist and hygienist so I could have a more quality hygienist appointment. And you can do the same thing. I also made an appointment with with my own personal physician to have an annual medical. If you're someone like me who, you really are a little bit wary of the healthcare abroad and country, even though I know Peace Corps is doing the best they can, if you have health insurance in the United States, just go ahead and, do your hygienist and physical examination here in the United States when you are at home. The other thing that I will say, and I think I have discussed this a little bit on some of my other videos, was during my service I did have really, really good health, but there was one time that I did get a stomach bacterial infection, and it was from eating pork. Definitely pork is a product that you need to be careful with in other countries. My host family ran a business making pork tamales, and how am I going to say no to that? But anyways, I did get a bacterial infection from one of them, and it was extremely painful. My particular site had a Peace Corps approved pharmacy, and I did have site mates, so my site mates were able to go to the pharmacy for me and get the prescription that the PCMO had advised that I get. That was pretty much taken care of, and it was resolved within a few days. Luckily, I was healthy for the majority of my service, but there were a few volunteers that I knew of during my service who were medevaced, so that's medically evacuated. Now, that is not a termination of your service. That just means that you need to go to the United States for healthcare reasons that cannot be provided to you within country. For those volunteers, they would go to the United States, do what they needed to do medically. Some people, it was even a surgery or whatever, something like that, a little bit more serious. And then they would have 45 days for their physician to say that they could return to country. So if you're not able to recover within 45 days, you will be med-sept, which is medically separated. So obviously that's like really scary. A lot of people really don't want to be med-sept during their service. Obviously, they're there to serve. They don't want to have to be dealing with their own medical issues. But if you're not able to recover within 45 days when you're medevaced, you will be med-sept. For more serious terminal cases, there are cases where there won't even be a medevac option, and you will just be med-sept right from the get-go. So keep that in mind as well. Finally, we get to COS. Now, unfortunately, my COS was a little bit different than yours will be, most likely, because as I said before, my country was evacuated. All 168 of us were evacuated. So I actually had to do my COS medical from here in the United States. And again, luckily, I was still under the age of 26 and able to take care of my COS medical under my parents' health care. But definitely, it was a little bit rocky for us. So if you're really wondering what sort of medical service will be provided to you post-service, I highly recommend that you talk to someone else, just because, again, I was evacuated. I don't feel like I have the authority to really speak on this subject. The final bit that I want to talk about is specifically for women in regards to menstruation, your period during Peace Corps. So there's a few different ways to approach this, and basically whatever country you are serving in will likely have different pads or tampons or whatever the local women use when they are menstruating. In the case of my country, tampons are not really a popular option, just because it is a Catholic country and different people feel different ways about tampons. So definitely pads were more accessible in country, and tampons were much more expensive. So if you want to just have your period like normal, then you can, look into what the locals are doing for that. A second option is to buy a menstruation cup or Diva cup. A lot of volunteers liked this option, the volunteers who chose to continue having their period, just because they didn't have to spend any additional money on tampons and pads, because remember, we only make $250 a month, so anything that we can do to save money is really helpful. So if you want to continue having your period during Peace Corps, then I highly recommend that you look into getting a Diva cup. And all the volunteers that I talked to had no issue, cleaning out, washing their Diva cup or anything like that. Now, if you are more in the area where you're like, wow, I don't want to have my period at all, there are other options as well. One thing that you could do, of course, is just skip the placebo week if you are on the pill, the birth control pill. If you skip the placebo week, that's generally the last week on your birth control, then you just won't have a period at all. It will just skip over, and talk to your doctor first, but doctors will generally say that that's that's totally fine. And then the final thing that you could do is just get an IUD, and a copper IUD. That just means that you won't have a period either, but you also don't have to take the pill. It's also a form of birth control. Those are like basically the 4 different options that you have in regards to your period during Peace Corps. That pretty much covers the topic of periods and women's health for Peace Corps service. I hope you found this video interesting and useful and helpful as you're applying to the Peace Corps. If it was helpful to you, please hit that like button. It would mean so much to me and this channel. It helps other people find out about it. If you are new to this channel, I would love for you to subscribe. If you are interested in following me in my journey through Europe, definitely check me out on Instagram as well as my WordPress blog. Thanks so much for watching this video. I'll see you all next week.